If your liver were a person, it would be the hardest working multitasker, detoxifying booze, managing blood sugar, producing cholesterol, storing vitamins, and metabolizing just about everything you throw at it. But like any overburdened worker, the liver shows wear and tear with age, and some of its cells start waving a white flag. These are senescent hepatocytes, cells that have permanently exited the cell cycle but stubbornly refuse to retire quietly. Instead, they stew in inflammatory signals, secrete disruptive factors, and may play an uninvited starring role in the development and progression of fatty liver disease. Fatty liver disease, which includes both non-alcoholic fatty liver disease, NAFLD, and its more sinister sibling, non-alcoholic steatohepatitis, NASH, is increasingly common, especially in aging populations. Traditionally, it's been pinned on overnutrition, insulin resistance, and poor lifestyle habits. But now we know there's more to the story. Behind the visible fat buildup and liver scarring lies a molecular mess of cellular dysfunction, and senescent hepatocytes are right in the thick of it. They're not just innocent bystanders caught in the crossfire. In many cases, they may be the ones lighting the match. When hepatocytes, the main metabolic workhorses of the liver, become senescent, they change dramatically. They stop dividing, accumulate DNA damage, and begin expressing cell cycle inhibitors like P16-INK4A and P21-CIP1. More importantly, they secrete a nasty mix of cytokines, chemokines, growth factors, and proteases known as the SESP, senescence-associated secretory phenotype. This SESP turns the liver microenvironment into an inflammatory swamp, attracting immune cells, exacerbating fat accumulation, and promoting fibrosis. It's the biological equivalent of a few disgruntled employees poisoning the whole office vibe. But here's where things get weird, in the best possible way. Not all senescent hepatocytes are the same. Using high-dimensional single-cell RNA sequencing, researchers have begun identifying distinct subtypes of senescent liver cells. Some appear to be strongly profibrotic, producing transforming growth factor beta, TGFSS, and other scar-forming signals that summon hepatic stellate cells to lay down collagen like there's no tomorrow. Others are more lipotoxic, jamming up metabolic pathways and hoarding fat droplets like doomsday preppers. Still others might even have transient, adaptive roles, slowing cell division to prevent damaged cells from becoming cancerous. The challenge lies in distinguishing the truly dangerous from the merely grumpy. This is where machine learning gets to flex its digital muscles. By combining transcriptomic data, epigenetic markers, and spatial information, AI models can classify senescent hepatocyte subtypes in ways that were once impossible. Think of it as the world's most judgmental liver biopsy, capable of tagging every cell not just by its appearance, but by its functional behavior, metabolic capacity, and inflammatory tendencies. It's no longer enough to know that senescent cells are present. We now want to know which ones are dragging the liver downhill, and how they're doing it. And that brings us to the therapeutic dream, senolytics. These are drugs designed to selectively eliminate senescent cells, like targeted cleanup crews for dysfunctional tissues. In mouse models of diet-induced NASH, senolytics such as dasatinib plus quercetin have shown promise, reducing hepatic inflammation, improving insulin sensitivity, and even reversing fibrosis. The results are tantalizing, suggesting that kicking out just a few bad cellular tenants might allow the liver to regenerate, remodel, and function more like its youthful self. Of course, not all senescent hepatocytes are equal villains. Some may serve as a biological brake, preventing damaged cells from turning rogue. Others may help orchestrate temporary responses to injury. That means carpet bombing the liver with non-specific senolytics could do more harm than good. The goal now is precision, identifying the most deleterious senescent subtypes, especially those associated with metabolic dysfunction and chronic inflammation, and targeting them with molecular sniper rifles, not shotguns. Another exciting possibility is combining senolytics with metabolic therapies. Imagine a dual-action strategy. Clear out inflammatory senescent hepatocytes while simultaneously restoring lipid balance with GLP-1 agonists or SGLT2 inhibitors. Or perhaps senolytics could be used alongside fibrosis inhibitors to both reduce scar formation and remove the upstream signals driving it. This kind of synergistic therapy could be especially effective in aging patients, whose livers are often navigating multiple pathologies at once. In the future, diagnosing and treating fatty liver disease may start with a cellular fingerprinting test, a scan of which senescent subtypes are present, how aggressive they are, and what therapeutic targets they expose. A 70-year-old with predominantly profibrotic senescent hepatocytes might get a different treatment than a 50-year-old with lipotoxic, pro-inflammatory subtypes. It's a brave new era of hepatology where pathology isn't just something seen under a microscope, it's something measured, modeled, and managed at the single-cell level. So the next time someone tells you fatty liver is just about eating too many cookies, you can kindly correct them. It's also about cellular identity crises, age-related molecular sabotage, and some deeply confused hepatocytes who are way past their prime. The good news? With a little help from machine learning, targeted therapy, and a growing understanding of cellular aging, we might just teach the liver how to age more gracefully and metabolize with flair.